Together we achieve victory over heart failure.
Hello, I'm Dr. Rohan Sonawane. I'm an interventional cardiologist at Rhythm Heart Care and Diagnostic Center, Varje. So today we are talking about heart failure. Heart failure is causing silent endemics in India, and India is fighting against heart failure so long. What is exactly heart failure? So heart failure, when your doctor tells you that you have a heart failure, the patient generally thinks that it is the end of their life, and the heart failure is a frightening thing, it seems. But what is exactly heart failure? Heart failure is your heart is struggling to pump blood as effectively as it should. Ejection fraction, you usually heard of this term, which is usually calculated from 2D echocardiography, which measures the how well your heart pumps blood. Normal ejection fraction is around 50 to 70%, or more than 60%, you can usually say. But in patients with heart failure, the ejection fraction is less than 50%. And patients usually present with breathing difficulty, swelling over their limbs. Patients sometimes present with fatigue. And a patient may say that he is having palpitation, chest pain, nausea, decreased appetite, and so on. So, why are so many Indians affected by the heart failure? Genetics play a significant role. Indians are genetically more vulnerable to cardiovascular diseases. To add on this, the patient is present with hypertension, diabetes, obesity, and there are some habits like alcohol consumption, smoking, tobacco chewing. It all adds up to the causes of heart failure. So, how can we protect ourselves from this disease? So, our heart works incredibly hard to keep us alive. There are five golden rules that we can follow to return the favor, that to keep your heart healthy. So, early detection of heart failure through regular blood tests, 2D echocardiography, echoes, and ECGs. And you should make some dietary changes like reduce salt intake, reduce fats and saturated fat, and cholesterol intake, trans fats. You can include vegetables, green leafy vegetables, and so on. You can incorporate daily exercise into your routine, like walking for 30 to 45 minutes a day or 5 days a week. That is sufficient to keep your heart healthy. And practicing stress management. Psychosocial stress is the most important cause of heart failure. So you should practice stress management. And I was already mentioned that quitting alcohol, tobacco, and smoking also helps to protect your heart. So what is come after next after the heart failure diagnosis? Thankfully, medical science offers numerous equipment options. It is possible to lead an enjoyable, meaningful, and productive life. Heart failure medication improves quality of life and longevity. There are so many medications in the market that you can try on to reduce the symptoms and improve your heart functions and all. So there are some devices also like biventricular pacemaker, implantable cardioverter defibrillator, and heart wall repairs and replacement to combat the heart failure. And the last resort treatment option is the heart failure. So lifetime risk for heart failure is 1 to 5 in for both men and women. Remember, awareness and proactive measures are key in combating. Thank you.